Come make a conversation. Hello everybody, it's your favorite, right? Today we are going to talk about contraceptives or contraception. These are the methods that are used to prevent unwanted pregnancies. It helps us to plan for our families, to plan the number of children you want to give birth to plan the child spacing in families, because of family in the way you want to see young elder born and they are gone for 6 months. So it is only now why that we can teach more about contraception. It's very important. And I hope that as you're coming to this video like that, you have been liking, sharing, and subscribing to our page. We need consulting on Facebook, Instagram, TikTok, and everywhere you will see it. Now there are different types of contraceptives that some of you even use. I don't know that it's a type of contraception. The first type I'm going to tell you about is the natural method. When I talk about the natural method, we talk about the calendar method, withdrawal method. The calendar method, a method where you actually take your calendar and you count your menses. You count your menses, you know, say this time to this time you are unsafe, and this time to this time you are safe. The second type of the natural method we call the withdrawal method, that we actually call coitus interruptus. When somebody talk and say, no, my withdrawal game is very good. Withdrawal game is so sabi. The natural method has no side effects, but it doesn't protect you from any sexually transmitted infection. And most of the time, it is not the best, The natural method will definitely fail you, especially coitus interruptus, which is a withdrawal method. Everybody thinks that you can withdraw before time, but most of the time it fails. So if you don't need any particular prescription, you don't need any money to do that. You don't need it is natural. You don't pay for it like this. It is free. So the next type of contraception we're going to talk about the barrier method. In this method, there's something that blocks the sperm from meeting the egg. That is why there will not be fertilization. For the natural method, you are calculating your cycle in such a way that the sperm doesn't meet the egg. But now for the barrier method, there is something preventing the sperm to meet the egg. That is what they call the barrier method. And for that one, we are talking about cervical caps, the female condoms, diaphragms, prevent the sperm from meeting the egg. So the advantages of the barrier method is that it is cheap. You can have it everywhere. Really affordable. It doesn't use any hormone. It doesn't affect the cycle, and also it doesn't need any specialist activity or any special way of using it. It is very simple and very common, affordable everywhere you want. But it is and also it prevents from getting STI. But the disadvantage is that it can at any moment break and fail you. That is, if you don't use it properly, there's a probability of it to fail and you will find yourself getting pregnant or having an unwanted pregnancy. The hormonal method, it is the next method that we're going to talk about. This hormonal method is just the use of medications to alter or to stimulate your hormones to prevent you from getting pregnant. And for this method that we are talking about, we usually have pills. You know that pituitary, that is what everybody uses. Postinor. You use contraceptive patch, you use implants, you use vaginal rings. And these methods of contraception usually is very effective. These are one of the advantages. It usually reduces menstrual cramp and it regulates your menstrual cycle. So the hormonal method usually has its side effects or its disadvantages. So when you're using the hormonal method, just be prepared to always have nausea, vomiting, cramps sometimes, irregular menses, and much bleeding or light bleeding or intermittent bleeding during your cycle. These are the disadvantages of the hormonal method, and it's normal for you to have those side effects, because hormones are actually being tampered in your body, so definitely there should be side effects. The next method of contraception I'm going to talk about is the intrauterine device. Intrauterine device. It means inside the uterus, so they put on device for the way it prevents fertilization of the egg by the sperm. This IUD, this intrauterine device, usually is inserted by a professional into your cervix, and it actually stands there and can be there for the number of years that you want. It doesn't have anything to do with your hormones, it doesn't affect your cycle, but it doesn't stop you or it doesn't prevent you from any STI. You have to maintain a very good level of hygiene and also use your protection. Need the professional to actually take care to put this device, and when you want to remove it, you equally need a professional to remove it. But it can be for years. The disadvantage is that it doesn't protect you from STI, sexually transmitted disease. But I'm going to talk about the emergency method. The emergency method is when you have already had unprotected sex on a dangerous day, and then you go for an emergency method. The emergency method here, we're going to talk about the pills, what everybody knows outside there, Postinor or Rapiluzumab. This method has efficacy within 72 hours. After 72 hours, note that it cannot prevent any pregnancy. So the emergency pills are there to prevent fertilization. It is not there to stop a fertilized egg. You guys have to be very careful with emergency pills. That's why sometimes you guys take pills and then you find yourself getting pregnant. It is very important for you to know. So the next method of contraception that we're going to talk about, and I think this is the last one, it is the permanent method. For men, that is really disconnect the fact say your sperm will come on your body. That means they do what they call a vasectomy. A vasectomy is the ligation of the sperm cord, and by doing so, you will never be able to impregnate a woman again. And for the woman, they call tubal ligation in such a way that all the ovaries who are released, they will never have a way back to the uterus for sperm to come out fertilized. And these procedures are procedures which are permanent; they are not reversible. Once you have done that, that is it. It is for life. You never have a child again. Some medical conditions can make you to go to this method, but some others are just decisions by individuals. So you see, these are the different methods of contraception that I have just described to you. Come to our page, comment, ask your question, and let's discuss this. It is very important. This conversation they give on us, so they pay for get them and they give on for free. This is actually family planning that we're doing. So let me give you the advantage. First of all, it gives you child spacing. It makes you to have child spacing. That is, you plan on when you want to give birth. Some people just get married and then you see every month the woman is pregnant. It's because you don't do your family planning. You don't use contraceptive. These are techniques that help you to plan how you give birth to your children. Give them space. Also, it helps you to reduce pressure. You sometimes you find yourself, you go to a school, brothers are at difference of 1 month. That 1 month self will feed the beginning, you know, feed that. When I day for us, chop no day. Papa and mama, when I get 7 picking them, age difference, na 6 months, my brother. Family planning will help you use contraceptive methods. The contraception method also is an advantage because some of them prevent you from contracting any sexually transmitted disease. I want to tell you, there's one myth that is around that when you have unprotected sex, you drink whiskey, and the whiskey will permit you or will help you to prevent pregnancy. That one is a lie. It is a very big lie. Whiskey has nothing to do with the uterus or with fertilization. Whiskey instead affects the baby during the early stages of pregnancy. Definitely give birth to a child with deformities, and it can cause miscarriage. That is, if you actually drink whiskey. But if you think that because you had unprotected sex yesterday and you take a glass of whiskey and you swallow, or you take a glass of salt and Maggi you swallow, and you're going to come to pregnancy, it's a very big lie. So be very careful what you're doing and watch what you take. Don't be shy to contact us or ask questions or consult us. We are there for your help and we will always be there. Just call Renee Consulting and tell us how we can help you.